With the healthcare law, the new healthcare law that was passed to sort of hold down costs, the goal was a 1 to 2% increase every year in healthcare costs. So even the sort of goal, which we haven't achieved yet, of the recently passed healthcare law was still to have increasing healthcare costs. At that rate, every dollar in revenue that we raise, 100% of it will go to the healthcare industry in about 40 to 50 years. How do we, without a public option or a single payer, how do we actually stop the increase in healthcare costs and actually decrease the sort of how much we're paying for the healthcare industry?
Yeah, no, good question. When I was your Democrat nominee for Senate, I did support a strong public option. I thought it was an important alternative to have. And I think that, I know we've talked a lot how we get there. I think a couple things, that we have started on a path that we need to accelerate to save costs. Healthcare costs are going up 8 to 10% in Massachusetts every year, which is why in 2004 this state did say we are going to do some healthcare reform, we're going to get everybody insured, and we're going to keep the quality up. Now we got to address costs. Harvard's played a huge role in demonstrating, I think, that we have a system in Massachusetts that although we have good healthcare, and good healthcare for some, but not for everybody, we have haves and have-mores of hospitals, and then we have the have-nots. By the way, I am from North Adams, so I am very much aware of what we need to do to keep that hospital open, and it is a good wake-up call. So what are we trying to do? We are moving away for fee-for-service, because if you're a big not-for-profit, and there are players in this market that we have shown by our studies are able to get $10,000 to be reimbursed for a knee, when other hospitals only have the negotiating club to do 5. I'm making those numbers up, but you get the idea. So unless and until we turn to more community health centers, more prevention, which, by the way, allows us to address this mental health, behavioral health disorders, because when you have a system where you only get paid if you do a thing, then guess what happens? We just do things. Someone comes in and says, I don't feel good. Okay, go for a CAT scan, go for an MRI. They get reimbursed for that, but the person may not be any better. No one is responsible for the health care. So it means looking at changing to community health care, accountable care, making sure people can get what they need, addressing those cost drivers like diabetes and asthma, which we don't do now, which will bring healthcare costs down for everybody. And I don't rule out down the road that there's a better way to do this, but I think we are on a path now to try and make this much more accessible, better healthcare, better outcomes for everybody. And then we look at, can we get this state or the rest of the country to accept it? It's not been helpful to have websites that don't work, but I would note that those are the private sector. Everybody thinks the public sector can't do anything, and then private sector is not perfect either, believe me, I understand that. But half of our budget, important to get it right. I'm going to continue to work as governor with the legislature and with our health policy committee and our CHIA to make sure that we get more equity between our haves and our have-not hospitals, including reimbursement rates around Medicare and Medicaid. That's one of the big problems for that North Adams Hospital and other places in Massachusetts.